Roll 2 Basic is a new capability for Army, which is a light and manoeuvrable surgical facility that can also hold patients after they have surgery while we await for evacuation. It's a setup that we're delivering in 4 tents with a really low profile. That means it can push pretty far forward to shorten the time from someone being injured to getting their life-saving surgical interventions.
So the Roll 2 Basic can be deployed in 2 20-foot shipping containers via land in trucks, via air on planes, via the sea in some of our LHDs. It can be underslung under CH-47s or via a smaller littoral transport asset to the beachhead.
We've got this happening in 4 tents at the moment. The first is a headquarters tent where patients are tracked. We have a resuscitation tent where there's 2 beds that we can start those life-saving interventions on. The next step in that journey is the operating theatre, which also has a sterilisation capability to extend our ability to stay in the field. And finally, there's a ward which has intensive care and low dependency beds where patients would wait for evacuation.
So when a patient comes through the Roll 2 Basic, the nursing officer will be at the head of the bed. Their role is to maintain airway and monitor for breathing. You'll have 2 medical technicians either side of the patient. Their roles will be a wet nurse, which is cannulation and administering medication. And on the other side, you'll have a dry medic who will be in charge of monitoring the patient, ensuring that pulse rate and blood pressure is within parameters, and then relaying that information to the medical officer. So once the patient is stable, it's up to the medical officer to decide whether they roll into the theatre room or they go into the intensive care unit.
So the Roll 2 Basic broadly can provide 12 hours of surgery every 24 hours, which for planning purposes is about 5 surgical cases.
So as a general surgeon, my role particularly is to provide really that surgical capability, particularly looking at that damage control, so that immediate surgery that needs to save someone's life in order to then be able to move that patient to more higher level surgical capabilities down the line.
I think the really cool thing about this capability, it's modular, so it can be shaped to support different tasks, whether that's a large-scale combat operation like we're supporting on Rhino Run this week, or a humanitarian and disaster relief mission. We have the capability to provide those interventions to people all across the spectrum of those environments.
People should be reassured that we are now confident that the Roll 2 Basic is a viable capability that can be deployed close to point of injury and save lives.